Going to the doctor, not very high on the list for most men. And according to the doctors at SLUCare, most guys will only seek help for problems when issues develop in the bedroom. Joining me is Dr. Clay McDonough. He is a urologist at SLUCare. And Doc, okay, this, of course, it didn't surprise me, right? But I was reading that men as young as 30 are seeing their testosterone levels going down, which impacts so many other health issues. Let's start with that. Why are people so young seeing low T?
Well, testosterone is a bit of a controversial subject in the sense that, what is normal and what is not. The replacement of that certainly has a lot of health benefits, and it is worth looking into as something that could be fixed for, many patients that have, fatigue issues or low energy or, unexplained weight gain or, issues with sexual health. That's a part of that as well.
We know that low T leads to issues in the bedroom, right? That's why I laughed about that. The guy can be having a heart attack. He won't go see the doctor, but he got a problem in the bedroom. That's the first person he calls is the doctor, right? But other issues with low testosterone, I mean, it can impact so many other things. Let's break those down because it's not just issues that we would expect with low testosterone. What else might you see with low T?
Well, low T is just part of the big picture of men's health. One of my other things that I worry about with a lot of these patients is when those sexual health issues do come up. A lot of that is not necessarily a problem or a disease process in and of itself, but it's part of a bigger picture. One of the things we found is that, in men with, early onset ED, what you can find is that they're actually, this is due to vascular disease, and they're at risk for heart disease, heart attack, strokes that can happen within 5 to 10 years if not looked at and checked out.
Doc, I find it interesting because it used to be embarrassing for a lot of guys, and now there's commercials out there with former athletes talking about it. It's kind of more out there to be talked about. Now, you developed an online assessment. Tell us about that.
Well, you're right. Men's health is an issue that a lot of guys don't want to talk about. They kind of wait till it's a problem before it brings them in. Women have certain periods in their lives that they tend to go to the doctor related to childbearing and what have you, whereas men, you have your high school physical at age 17, and then next thing you know, you're showing up with major problems at 65, and so. We're trying to bring people in, and we're trying to do it in a confidential process that's, entirely online. So, patients can go in, they can take a questionnaire about some of their symptoms, related to low T or related to sexual health, and then it'll generate a score for them that indicates whether or not this is something that they should be seen about.
We only got a couple of seconds left. Very quickly, how do you boost testosterone levels back to healthy levels in addition to, I guess, the shots or the patches?
There's obviously living a healthy lifestyle is important. Folks who are overweight, if you lose weight, that's going to improve upon that. Simple stuff like quitting smoking. These are all things that can have an impact on that. And there's also some other delivery systems such as sublingual systems and gums and things like that. But it's all about living a healthy lifestyle, basically.
And don't be embarrassed about it, right, Doc?
That's correct. We've got online confidential ways to get in to see us, and people can book their appointments entirely online at this point.
All right. For more information and a link to the Know Your Score online assessment, we have that hooked up at fox2now.com. Doc, thanks so much. Great to see you, and hope to talk to you soon.
Thanks for having me.
All right.